having this attitude of this is my life, my one life. Let me try and make the best relationship I can with myself, because it's going to impact on everything that you do and everything you come across. Put your hand on your chest and say, this is a really human experience. Name it. Just say, this is painful and I'm still here. I'm still, talking to yourself. We'll get through this.
Welcome to the Choice Space podcast. I'm Dr. Lee David, GP, CBT therapist and author. Today, we're exploring how shame can show up around identity and belonging, and how wider social experiences and attitudes can shape this. We'll be looking at experiences within LGBTQIA+ communities, alongside the challenges faced by people from any group who may encounter discrimination or feel excluded. Shame is an intense and distressing emotion. It can strongly influence our thoughts, our sense of self, and the way we relate to others. It can create self-doubt, undermine our confidence, and make it harder to feel relaxed, safe, or fully ourselves in relationships or social situations. There is a way forward. When we understand how shame develops and approach it with compassion, we can create room for connection and a kinder relationship with ourselves. To explore this today, I'm joined by Simon Lyne, a cognitive behavioural therapist with experience in sex, relationships and trauma, and an author whose work focuses on shame, sexuality and well-being. Simon, welcome. Could you introduce yourself and share what drew you to this area of your work?
Hi, Lee. Thank you. Yeah, I'm Simon and I work at Practitioner Health. What drew me to working with shame, I think, was a personal experience, really, and growing up feeling pretty bad about a big part of my identity and understanding how that works and doing a lot of work on myself. Yeah, it just ended up being my specialist area, really. And then a lot of people find their way to me based on that, I think.
Can you share a bit more about your work and the kind of experiences that might trigger shame in the people you work with?
The people who I work with privately, there's a lot of people from the LGBTQ+ community, and I advertise myself as a specialist in that area. So I think people tend to want to work with somebody who has a kind of intimate understanding, I think, of their experiences, their life, their community. In the NHS, the same is true, but also I see a wider population of all doctors and dentists.
So, Simon, what is shame? Because it's one of the most powerful emotions. It can have a really big impact on how we behave because it's such a distressing emotion. Can you talk to us a bit about what it is? Because I think it's a universal human emotion, isn't it?
It is a universal human emotion, and I mean, as I understand it, there is potentially a reason why we feel shame. Socially, it kind of makes us aware that we maybe are doing something or we are something, which is not going to allow us to be a part of the group. We kind of survive as groups. So we get a sense of belonging. If we feel shame, then it's a signal that maybe something is not quite right and we need to adjust that.
So really, it's a survival response, isn't it? It's about not wanting to be excluded from a social group. And that's really understandable. I often flip it to think, well, it actually reflects our urge for connection and wanting to feel supported and connected with people around us. And when that feels lacking, then obviously it can be very distressing and challenging. So it's the flip side of seeking positive connection. How do we recognise when shame shows up? Let's think about it. Might trigger different feelings, how we think about ourselves and how we behave. So lots of impacts. Talk us through some of the responses that might help us recognise that actually shame might be at the root of some of the things in our lives.
What you were saying, I think, about connection is really, really important. And a lot of theories suggest that actually it is a relational thing. It's something that you experience in relation to other people. And there's a writer or therapist called Patricia DeYoung. You probably know her, who her definition has always stuck with me. And it's a bit of a mouthful, but it's something along the lines of shame is one felt sense of self disintegrating in relation to a dysregulating other, something like that. So basically you feel shame when you have this sense of disconnection in the eyes of another person. So it's a kind of two-person experience. There are theories that actually, as a baby, if you don't get that friendly mother face, attentive, I'm here when you cry and I care about you, then shame can start to develop from then. Obviously, growing up, experiences that we have at school, from society, in families, religion, all over the place, really. We are going to receive messages about what is expected, what are the cultural norms. And if we feel that we don't fit into that, that can create a sense of shame. So it's not just I don't belong. It's about who we are. It's not just about behavior, like I did something wrong and then I can fix it and then get back on track. It's about there's something core about me which is wrong, which is where it really can cause a problem. And if it happens consistently, repeatedly over years, this kind of cumulative effect is that we end up with this sense that we are kind of fundamentally defective or flawed in some way, which means that we aren't going to be able to function in society as we need to.
So it's a really deep-rooted experience, and it's a sense of ourself about who am I and do I have validity and worth as an individual, which is a very powerful idea, isn't it? It's very significant.
Yeah, I think it's the deepest. I think it's the deepest. I think because it's about your core self. It's about your identity. It's not about just what you do. So it would be like, I am bad. I am wrong. I am unacceptable in some way. It can be devastating, and it can take a lot of time to try and ameliorate shame, toxic, long-term, chronic shame. And I think that for some of us, we're never going to be shame-free, but we find ways to identify it and understand it and manage it.
Yeah, so there's a few things to pick up on there. Going back to where it comes from, I think many of us at school have had challenging experiences. I can certainly remember a number of experiences I've been through in childhood that were difficult. And they're very powerful, aren't they? They have such a big impact. And if we do feel different for whatever reason, and there's lots of reasons that we may feel different, it might be due to neurodivergence, it might be due to ethnicity, it might be due to our sexuality, it might be due to our accent or the status of our parents' profession. There are a lot of reasons that we may feel disconnected to those around us. And I think how they respond to us has a big impact, doesn't it?
Yeah, huge impact. Yeah. I guess, really simplified way, it would be the difference between, disciplining a child based on what they've done rather than telling them that they are bad, that they're a bad child, they're wicked or unacceptable in some way.
And I think as children, when there are difficult experiences around us, I think we often do try and take ownership of those. It must be me, because in some ways it might feel safer for a child to think, it must be my fault, I might be able to fix it, rather than actually this world is really harsh and feels uncertain and a bit unsafe, which perhaps might be more as an adult self, we might be able to see that those experiences really were challenging and that we were in a situation where we were very vulnerable and perhaps there wasn't some support that we needed.
I think you're right. It is exactly that. But it's also, I don't think it's just that it's safer. I think it's the only option available. I just don't think as children we have the real conscious cognitive capacity to be able to understand the information that's coming our way. So it might not even be that things are overtly directed at us, that we're not told that we are bad or wrong or unlovable. It might be that maybe our parents we're witness to something, or there is some way that they can't look after us, and then we take responsibility for that, or they're having issues in their own relationship, and we understand that it must be something essentially about us that needs to change in order to make them happy or to stay together or to get our needs met.
So do you think we could see our shame part, if we see it as a part of ourselves, as a very young part who developed as a coping strategy to deal with stuff that was just very difficult at a particular point in life?
Yeah, I think so. I think because it is it is a universal emotion and it's just encoded in us to experience shame. The majority of us are going to understand the experience of shame, and it will be something that we will have experienced in childhood. So I think it does feel like a young part, even though we experience it throughout our lifespan. It does feel, for me at least, and many of my clients, I think it does start early, and so it feels young.
Yeah. And so thinking about how it then affects us in adult life, when you think about some of the work you're doing with your clients, what type of experiences would often contribute to when it wakes up or when it starts to have an impact?
It doesn't have to be a huge thing. It might be criticism. Maybe they've made a mistake. Maybe a relationship is having issues or ends. or they're having problems with a friend. It can be small things, feeling that they're not included or actually feeling excluded, getting something wrong, anything where they might feel judged, or they might have an influx of self-critical thoughts and then want to go overboard to try and fix it. So lots of the clients in my NHS role will identify as perfectionists and people pleasers, which is a defense often against feeling not good enough or defective in some way. We can respond to it by believing it. And so we just constantly feel that we are bad or wrong and live as if it's true. Might completely avoid it, avoid getting into a relationship, for example, if we're afraid of not being loved or being rejected, or completely overcompensate and do everything we can to gain the affection of other people. So it can be something which just really informs people's lives on the day to day. It's, it's quite present.
Yeah, so it can have a really big impact and it can show up in quite different ways. So it might look like avoiding experiences that make us feel vulnerable. So if we feel vulnerable in close relationships, we might avoid those. It might also look like avoiding making mistakes. So we become a perfectionist, we become highly pressurized in order to try to avoid ever having criticism because it feels really intolerable and it feels really fearful about that experience. So it feels like it can present quite differently then, but underneath there's that common theme.
You're trying to avoid the shame being triggered. Yeah. So you're just constantly trying to, it's like whack-a-mole. You just got to kind of just keep it hidden. And that's another thing about shame. It feels like it's just you. It's a one person experience. We all experience shame. You can feel very alone and rotten at your core, and you do anything to try and hide that. So people withdraw, they don't share it with other people. We want the ground to swallow us up. We want to hide away. We don't want to be seen. We don't want to look at other people. We don't want them to look at us. It lives in the dark, and we don't talk about it.
Actually, another area that I've come across shame being quite significant is around body image. And it's a huge trigger around our appearance and how we see ourselves. And that can also become linked to experiences of shame, often again linked to perhaps childhood experiences. Is that something that you've come across, Simon?
Yeah, definitely in the LGBTQ community, there's a big issue with body image and perfection, for sure. But I think it's anything where you feel that you're being given the message that there's something wrong about you. So if it's to do with your weight, maybe you're the wrong shape or whatever, and you constantly fed this message from maybe school, peers, family, like you need to change. This is not right about you. This is not acceptable. Again. I mean, you know, you don't have many options available to you other than internalize this sense that you're unacceptable.
And there can be lots of other influences for groups like the LGBTQ community. So experiencing comments which are negative that make it feel my sexuality is not acceptable here, or my choice of clothes, or my choice of how I am. There's a sense of that coreness of us is somehow not being acceptable in the environment that we're in.
Absolutely. I mean, that's something which, I mean, things have changed, but it still absolutely exists. But in my day, it was pretty much routine that, that it was just socially acceptable, socially sanctioned for people who were different. I mean, different generally, but something to do with their sexuality. That was just kind of expected, that you would be singled out and shamed for a perceived difference in that way. And there are lots of reasons why small marginalized groups have suffered, I think, a higher proportion of internalized social stigma than maybe their heterosexual counterparts.
And so it's just being that awareness of maybe noticing, how am I showing up in different experiences? What are my triggers? I think it feels to me like as starting to recognize ourselves, and the very starting point to combat shame is to be able to name it and to recognize that it might be playing a role.
Yeah, that's definitely one of the first points, is the self-awareness.
And sometimes people minimize, oh, that was a small comment. We hear this sometimes about these microaggressions or comments that are throwaway comments, and they may not have been meant with malicious intent, but they still are very triggering, aren't they? And particularly when they're cumulative, they can have a big impact on how.
Because they're cumulative, I think it's like kind of death by paper cut, isn't it? If you do it enough times, then it becomes the truth, or the sense that, well, it must be me then, because I've heard this my whole life, treated differently because of, the color of my skin, or, my color of my hair, or, my sexuality, or my gender. It is hard. Yeah, it's hard not internalize some shame. Absolutely.
So, what I'm hearing is that there is space to recognise that we can acknowledge and validate that shame is a really impactful experience. We've discussed how wide it is across human experience. And the first step is to name it and recognise, how is it affecting me as an individual person? And then the next step is to look at, how do I start to break it down? How do I dismantle it and find a different relationship with myself that is a bit kinder and a bit more accepting? So can you talk us through, what are the steps that start to dismantle shame?
Crikey. Well, that's a big question. I think that even the naming it, I think you have to do gently, because in therapy, if you do it too quickly, that can feel too much and too shaming and too exposing. So it's a kind of gentle process, understanding how it works, understanding that there are theories around it. So normalize it, a bit of psychoeducation. This is a universal human emotion. It feels that it's you that is bad or wrong, but actually feelings aren't facts, thoughts aren't facts. This is what we understand as a very human experience based on things that have happened to us. So a lot of that is a kind of the groundwork, I think, but always moving towards developing that real powerful and healing sense of love towards yourself, compassion, friendliness, whatever you want to call it. That is how it's really healed. And that can be a relation with yourself. But in therapy, obviously, it is the presence of another human being who is attuned and not shaming and not rejecting, non-judgmental. Patricia DeYoung, who I probably badly quoted earlier, talks about bringing it into the light and the air, that it can't survive in the presence of, an accepting, compassionate other. And speaking it out loud, so it's not hiding in the dark anymore, is incredibly powerful. But ultimately is, in my mind, the way to manage it long term is to close the loop and have that relationship with yourself that you would for somebody that you really, really love and cherish and want the best for, a child that you have or your best friend. And it becomes like an endless source of healing within yourself. That's the trump card, really, in my mind. And people really struggle with that concept, and too early on. So, but that's the end point.
Yeah, so it starts as recognition, but not overwhelming, not getting overwhelmed by it. I think there's something about being able to name it, but creating a little bit of, perhaps that space is creating space to recognize it rather than space to allow it to overpower us.
Allowing it to be there and be held or contained within the room. So painful. I mean, shame, toxic core, chronic shame, it just feels like it could just completely destroy you.
Yeah. And so, which is why people do things that then perhaps on the surface seem unhelpful. They might do the
Drink,
excessive people
drugs,
Yes, drugs, alcohol, people pleasing.
attacking other people.
Exactly, getting angry, because actually anger, I think, often comes up around shame, because it's more empowering to feel angry and sort of raging than that sense of shame, which is very disempowering. And just like you say, I've had someone describe it to me in therapies, like it felt like they were being dipped in boiling oil. It felt like it was so uncomfortable that they would just do anything to try to get rid of that feeling. And so they would get very angry because even though that was quite destructive in relationships and it was having quite a negative impact, but still it felt like that was a safer choice than to sit with that. This is the Choice Pause, a short 2 to 3 minute tool you'll hear in every episode, each time with something different to help you pause, notice and choose your next step. These tools come from my books and our online wellbeing courses, and you can find links in the show notes. Today's pause is called a moment of self-kindness. Take a slow breath in and a longer breath out. Let your shoulders lower a little and allow your face to soften. Take a moment to notice how you're feeling right now, the emotions present and any sensations in your body. Maybe there's tightness, tension, or busy thoughts. You're not judging any of it, simply acknowledging what's here right now. Now invite in a gentle sense of kindness or care towards yourself. It might be breathing in a sense of warmth, placing a hand on your heart to wish yourself well, or allowing your posture to relax a little. Just a small shift towards friendliness and ease. If it helps, choose a short phrase that supports that tone. I'm here for myself. I'm allowed to pause. Or, I deserve care. Take another slow breath and allow that sense of kindness to settle around you like a warm cloak or a gentle hug. Nothing needs to change. You're simply giving yourself a moment of care. Now choose one practical act of kindness that you could offer yourself today. Something very small and very doable. Perhaps slow your pace for just a minute. Reach out to someone supportive, or give yourself permission to do something enjoyable or relaxing. Or choose an outfit that brings you joy or makes you feel comfortable. Now take a final breath in and let that kindly tone stay with you as you move into whatever comes next today. So we do need to recognise, but we need to not let it be like that wave that crashes over us. And I have read the idea about backdraft, where if you start being quite kind to yourself, and backdraft is if you have a fire and you open the door to try and put it out, that rush of oxygen makes it blaze really brightly initially. And so I've heard it described in those terms that when you open the door to shame, you can sometimes get a increase in intensity for a little while because you're leaning towards it and you're suddenly aware of it, and all your coping strategies to try and push it away, you're letting go of those. And so actually we need to be cautious in how we lean into it because it can feel quite overwhelming in those moments. And I just wondered what your thoughts were about that.
It's interesting. I hadn't had it described by that, but I think it does. It's definitely a thing that that people really struggle with. And so often it's actually, I think, more effective for us to start working on compassion directed elsewhere before we start turning it in on ourselves. There is a little bit of being able to talk about it in the room. So if they are experiencing shame, and I don't know, as a therapist, you might say, how does it feel to be with me? Obviously, and you're not kind of shaming and blaming and, creating more. So they have the experience of feeling compassion towards them. They maybe are able to describe a feeling of compassion towards, I don't know, their pet that's feeling sick, or a child in their life, or doctors, obviously, at work trying to help other people. So you can kind of start there. And the end point would be being able to kind of turn it towards yourself. I would start with building up a sense of what's it like to feel compassion generally before you start kind of turning it on yourself, and have that understanding that it doesn't cancel out the shame, it doesn't stop the inner critic from coming online, but it does also exist alongside. It's something that can be used as a counterbalance.
Yeah, definitely. I would sometimes focus with somebody who is getting a bit overwhelmed with the emotional side of shame on behavioural, sort of what can I do that treats myself with kindness? Because you can plan those things, even if you are experiencing emotions, whatever the emotion, you can still be quite structured and think, well, actually, if I was treating myself with kindness, I'd give myself some time out. I'd allow myself time to sit down and have a break. I'd make sure my working day wasn't overstretched, or I'd connect with people that actually feel positive and enjoyable. So there are things that you can put in place quite pragmatically. Do you think they also help to counterbalance that inner experience of shame?
Absolutely. Although sometimes there will be people, and in certain stages, where that stuff goes out the window very quickly. They go, oh, I don't deserve that. Why would I do that? And just, this whole, but that's quite early on. I've had many clients who have balked at the idea of compassion, self-compassion, or care, or looking after themselves.
People who do balk at the idea of maybe, do I deserve this kindness? What's the smallest step? Because obviously it may well be that somebody does need to have a supportive therapist who's experienced of working with shame to help them navigate if they've got really significant experiences of shame. But if they wanted to just begin to, in a safe way, lean into finding ways to treat themselves with more kindness or compassion, or whatever words feel right, what would you suggest?
Probably if they're very new to it, as a first step, I might be asking them, okay, so You're telling yourself that you don't deserve to be looked after. How is this helping get them to think about, really, is this what you would be recommending to a best friend? What is it that makes you so different that you don't need to rest or deserve kindness? And even if you don't really believe it right now, do you think it might not be worth at least practicing a little bit to see how it feels and see whether it actually makes you become dysfunctional or whether it actually helps you to feel a little bit stronger? Because there historically, I think, has been a misunderstanding about compassion, that it maybe it's a bit soft or touchy-feely, but actually, from my perspective, it's what really gives us strength to be able to face challenges, do difficult things, even that if the challenges are internal. If we're experiencing a lot of self-criticism, being able to have that part of you that's just like, oh wow, this is quite a lot. Yeah, actually, maybe it would be good to just stop and take a breath and, have a cup of tea, sit in the garden, call a friend, whatever. That can be incredibly healing.
I really like that idea of seeing compassion as strength. And that's something that I also try and emphasize for people. If we're kind to ourselves, we can actually be far stronger, we're more capable, we're more able to navigate life's challenges, aren't we?
Absolutely. I guess probably because it's something that I've been working with for quite a while. It's a no-brainer. It just, there's nothing bad about it, and it doesn't only benefit you, but it's gonna benefit everyone around you and your work, and everything gets a lot easier. I think of it like that never-ending porridge pot. Remember that children's story where
Yeah.
it just kind of like ends up just giving never-ending porridge? It's like that.
Exactly. And I think people mistake it for perhaps permissiveness, which is, oh, well, I don't have to do anything if it's hard. Whereas actually, often being compassionate means taking the harder choice. It might mean standing up for somebody when there's discrimination, for example, because actually our values are about, I want to be compassionate around relationships, and I want this to be in a workplace that is supportive for everybody. It's an inclusive space, for example. Or it might be that I'm not going to default to my unhealthy behavior that actually is trying to mask shame, which we've talked about alcohol, we've talked about anger. There's lots of self-destructive actions that we all take sometimes when we're triggered by shame. And actually that strength, we need the strength then, don't we, to sit with the discomfort and choose to do something that really is more in line with who we actually want to be as a person, that follows our values.
But yeah, definitely values are a really important thing. Rather than focusing on fear or being afraid, is focusing on actually what's really important to us at a deep level. Kristin Neff often talks about compassion in this way, that it can be really fierce. I think she calls it fierce self-compassion, that kind of like mama bear energy. I think that this permissiveness that people sometimes think of as self-compassion or just self-care even, that's self-indulgence in my mind. Just, I'm not going to just lie on the sofa and eat soft centers when I feel bad. I mean, I might do for a little bit, but not for long. It's actually being able to have the strength to do something difficult, to say, I don't like that, or, to stand up for yourself, or it's kind of a vulnerable position. But in order to feel strong within your vulnerability, self-compassion really is the agent that you need.
Yeah, and if we do experience it, perhaps we have made a mistake and then we're feeling triggered. And when it's driven by shame, there's that sense of, oh, I need to prove that I'm good enough. I need to somehow prove that I'm not this unacceptable, oh, I'm not the failure, or I'm not these really big words that are very sort of negative about ourselves, that's not true. I need to prove it by then getting it right. Whereas if we're able to step into that fierce, that strength of compassion, it's very much, well, actually, this is really difficult. This is a difficult experience. I can make room for that it's happened. I can have some acceptance, and I can think about how to go through this in a way that, again, maybe there's learning, maybe it's recognizing that actually I can let go of personal responsibility about certain aspects of this experience. Maybe I can't be responsible for everything. It enables us to just take a bigger perspective, I think.
I think that actually you've hit on something important, which is the distinction between guilt and shame, and that, you can make a mistake and do something wrong. It doesn't mean that you are a mistake or that you are globally wrong at your core. So I think an understanding that if it feeds into some deep down global belief, negative belief about yourself, we've got some work to do there. Focusing on just the behavior is a little bit more straightforward. We can say, I hold our hands up that I've made a mistake and make an effort to repair it as soon as possible, make reparations, apologize, whatever is needed. And that helps to reduce that sense of guilt. The shame is, as we've said, this whole time is more about who we are. So it's much more difficult, I think, for us to move through quickly. But that understanding, I think, is important. Yeah, because we make mistakes all the time. It's a human thing.
So it's that really the distinction between something has gone wrong and I really regret that that's happened. That doesn't equate to if it has happened, I am therefore wrong. I am therefore bad as a consequence, which is then when it makes it so hard, I think, for example, for clinicians, when something has gone wrong and it feels like I am the failure because this thing has gone wrong.
Yeah, yeah, exactly. And it happens a lot, I think, with doctors, which I think is interesting. I know that in your training and maybe in the NHS in general, there is a sense that, mistakes are kind of unacceptable. I know that's not the party line, but it does seem like it's kind of drummed into you that it's possible to not make any mistakes. And this whole idea of never events, I get it. We want to avoid really bad things from happening, but it's possible for bad things to happen. And we do make mistakes all the time. And they can be things that we can learn from and use in order to grow. I think people do tend to, a lot of the time, internalize them as signifying something about their competence, their ability to do the job as a whole. And it might be that they've done thousands of right things. When something goes wrong, they really struggle to process that.
And if we think a little bit about some of the specific challenges faced by individuals who may encounter discrimination, that's where we started talking today. It feels like there's a particular challenge about trying to reduce shame when there may still be experiences that are quite triggering for shame in our day-to-day lives. How do we start to address that?
Interesting point. I mean, it's difficult to expect the individual to be trying to make the change. I think we need to be contributing to system-wide change. This whole, we've, again, don't want to be too political, but it seems like we're swinging a little bit away from the diversity conversation. There was a time when it seemed like things were opening up and things were going to be more inclusive, and it felt quite exciting. That seems to have shut down a little bit recently. But I think that we do need to really, really work towards an NHS where we're leading with compassion and finding people you can trust that feel safe to you, who are accepting, who are non-judgmental is incredibly powerful. So find your people, get a therapist, obviously come to practitioner health, and work towards really showing up for yourself. I know that sounds like a kind of therapist thing to say, but, having this attitude of this is my life, my one, as far as we know it, life. Let me try and make best relationship I can with myself, because it's going to impact on everything that you do and everything you come across.
Yeah, so just seeing that as a relationship with ourselves feels really, really powerful. And I was actually working with somebody who had done work around the civility movement, which is around how we communicate in health settings and how that has a big impact on both clinician wellbeing, but also on patient outcomes. If we create that sort of civility, that positive relationships, how we interact. And we were talking about the fact that actually you can have an internal sense of civility, that actually we need to bring that inside as well. And that felt very powerful for this individual. He felt actually that really made sense, that, it does make sense that if we're polite and friendly and supportive at work, but actually that isn't just enough. So we kind of need both. It's not an either or, is it?
No, they go together. It's where there's an internal world and an external world. And so make the internal world as calm and peaceful and kind and loving as you can, and it will resonate outwards.
And I wonder if sometimes we don't have full choice around maybe some colleagues, but we do have some choice. So we might make a choice about which department we choose to apply to work in. And we might choose it based on, do these feel like supportive colleagues? I've always encouraged people to push that up their list for reasons about why they might take on a particular role, because I think it has such a big impact. And we can also counterbalance it with our personal relationships and really strive to find that connected group of people who get us. So I think if part of our life we're seen and understood, it can at least partially compensate, do you think?
Absolutely. Yeah, no, I think it's incredibly important. Being in connection with other people, being connected is really important.
So there's connection, there's being able to, as you mentioned earlier, bringing shame out from its hiding dark place and actually name it. And maybe with a supportive friend or somebody that you care about, able to say, actually, that was a really difficult experience for me. I just felt really uncomfortable in it. We don't have to necessarily use psychological, terms, but it's very much naming that actually that had an impact on me personally, and seeking somebody who's going to say, well, I've got your back, I really care about you. And that kind of mirrors that compassion in our relationships.
Yeah, having those people is priceless, really, as is having that relationship with yourself. That does a lot to counteract shame.
For those wanting to be a supportive friend, a colleague, a family member, what helps create a space, a culture where everybody can feel safer, more seen, more supported, and that just combats shame? And I think that's something that's very positive for us when we do that, that actually we benefit as well as that individual. We all do.
Yeah, it's kind of like exponential. Well, yeah, we need to kind of put more of that out into the world, just increase the amount of it in the world. But also, it already feels good to look after somebody in distress. So I would say the simple things: be non-judgmental, be curious, show that person that you are not going to reject them because they're being vulnerable with you, that you're not dismissing them, that you're not going to disconnect from them, especially in this, really painful moment, and that you want to help. Simple, human, very, very human stuff.
I think sometimes showing curiosity to understand somebody's experience, people can be fearful of saying the wrong thing, and they may not fully identify with some of that person's experiences, and they feel fearful about offending somebody or getting it wrong. And I think if we show compassionate curiosity, I'd really like to understand more about how you see the world and what language is the best language for me to use and what helps you feel supported. Like, you can ask the person, can't you?
Absolutely. But be curious to understand. We're not going to be disputing, especially someone's identity. We're not here to kind of like disagree with their experience. We're here to say, I get it. I understand. Yeah, I might see the world differently, but from what you've described, I understand the experience of shame, and I can understand how you would feel like that in that situation. That's so painful.
So there's a kind of willingness to learn also. Like, I'm really wanting to understand more about your experiences, and I will accept and validate as you speak to me. And so it's a lot of listening.
Yeah, I'm not going to just rush in with like oh, that's ridiculous because, you're such a nice person or whatever it is to try and discount it. It's not that easy. It's not something that is going to just disappear because we told them that we don't agree with it. Internally as well, it's kind of out of the realms of pure language. It's deeper than that. But there is so much good stuff that we can do to lift people up. And we just need to lead with love, really. Be human, be a good human, be kind, be friendly. Sometimes if I think people are going to struggle with the word compassion, just say, just be really, really, really friendly. Like, honestly, a really good friend.
That I think that's so helpful. So thank you so much, Simon. It's been a really interesting discussion today. So just to finish off, for our choice space takeaway, so we always like to end with just some practical tips that people can take away. If someone wanted to let go of shame just a little this week without being overwhelmed or having too great an expectation, 2 small choices might support a little bit more kindness or self-acceptance.
Listen to this podcast and
Yeah,
and tell yourself, put your hand on your chest and say, this is a really human experience. I know this. Name it. Just say, this is painful, and I'm still here. I'm still, talking to yourself. We'll get through this.
I love that. I love that. And I think I would add in, find one tiny thing that you can do for yourself that doesn't take too much time or effort, that just looks after you a little bit. So just put something in place that's driven by wanting to look after yourself and offer yourself a little bit of care, even if it's like 30 seconds or 1 minute of care. It doesn't have to be a big deal. And the other thing, I'm going to pick up on what you said earlier, which is to connect with people who lift you up.
Yeah. Or find someone that you can reveal just a little bit of what's under the surface for you. Just a tiny bit. Just be something real about yourself to somebody that you trust.
Yeah, I love that. I think that's so powerful. Okay, fantastic. Thank you so much. Thanks for listening to the Choice Space podcast. I hope this conversation has offered a little more room to pause, breathe, and find your own way forward. If today's episode has been helpful, please download, follow, and share with someone else who might value that space as well. I'd love to have you with me for the next episode. Until then, take care and keep making space for what matters most. Today's episode was produced and edited by Elle Dixon.